My name's Karin Rodland, and I'm basically in charge of all the biomedical research here at PNNL. The desired outcome of my work would be to detect all cancers before they have spread, before they have metastasized, when they're small and localized and can be surgically removed, so that no person has to die of cancer. For about the last 20 years, I've been really focused on ovarian cancer as a poorly understood cancer that's highly lethal for women. I also have been interested in breast cancer and more recently in prostate cancer. Biomarker research is discovering something that's different between a patient with cancer and a patient without cancer. And the earlier we can detect cancer before there are clinical symptoms, the more effective we are at treating cancer, because if we can remove a tumor early when it's small, we can cure cancer 100%. If it's gotten large and metastasized, we're much less successful. So a biomarker says something about the state of the body, and we use them for early detection, and we also use them to guide therapy. What is it about this tumor that's broken, and how can we fix it? Historically, most cancer research has focused on one or two proteins or genes at a time. And we've learned a lot about very narrow signaling pathways that way, but the cell is hundreds of interacting pathways. PNNL has developed technologies for mass spectrometry-based proteomics that allow us to look globally and quantitatively at all the proteins in a cell at the same time. We also have great strengths in computational biology that allow us to make sense out of all this data. And we've had expertise in systems biology over the last 10 or 15 years that allows us to integrate all these different types of information and really get a much more complete understanding of the system and how the system is broken, rather than looking at one component at a time. We provide fundamental tools for understanding the biology. We share that information with our clinical colleagues. They apply it. So as a scientist, the favorite part of my job is discovering new things that we didn't know before, particularly discovering things about how the human body works, how it works when it's healthy, how it works when it's not healthy, so that we can better understand disease, better treat disease, have a better outcome for people. I'm Karin Rodland. I'm a PNNL Laboratory Fellow, and I harness the power of science and the creativity of the brains around me to cure cancer.